Hello, I am here today to introduce the OECD Roundtable session on excessive pricing in pharmaceuticals. This session will take place in Paris in late November during the OECD Competition Committee meetings. Exploitative excessive pricing cases are brought when dominant companies are thought to be unfairly pricing their products. Such cases are rather uncommon. In the absence of exclusionary or collusive practices, excessive prices are thought to be self-correcting market failures or a problem better suited to be addressed by means other than competition enforcement. Some jurisdictions go as far as to not sanction exploitative practices at all. In these jurisdictions, high prices are not thought to be illegal, and excessive prices are not subject to competition law. In those jurisdictions where exploitative excessive pricing cases can be brought, such cases are subject to stringent screens to ensure that enforcement action can only be brought exceptionally when the high prices need to be addressed directly. Recently, there have been a significant number of excessive pricing cases in the pharmaceutical sector, particularly as regards generic medicines. This section will review the background of these cases and whether they meet the stringent screens set in the literature to assess whether exploitative excessive pricing cases have been appropriately brought. On the other hand, pharmaceutical markets are subject to a dense regulatory network. This reflects the peculiarities of competition in this sector. However, the entry of generics into the market is expected to enhance competition and lower prices. In this section, we will review the market developments that have led to increasing prices as regards some generics and the underpinnings of enforcement action against exploitative excessive pricing in this area. This session will also seek to address a number of different topics, such as what are the appropriate methodologies to identify whether prices are excessive, whether it is appropriate to bring excessive pricing cases in research-intensive sectors, whether there are other tools which are better suited to lowering the price of pharmaceuticals, and lastly, what is the interaction between competition and pharmaceutical sector regulation. We look forward to seeing you in late November in Paris to see you participate in this discussion. Thank you very much.